This video is produced by the U.S. Environmental Protection Agency to help parents and caregivers learn more about things found indoors and outdoors that can trigger asthma symptoms. Identifying a child's triggers and limiting their exposure to them is an important step in managing asthma.
Asthma is a disease that affects millions of children, but it doesn't have to affect their quality of life.
Daniela is very active. She does participate in any sport. I think that's one of the things that kept her from getting asthma attacks. It helps her to exercise.
A doctor can help you understand what causes your child's asthma attacks and develop a written asthma management plan customized for your child's case. Though there is no cure for asthma, the good news is that asthma attacks can be prevented.
It's important for patients to realize that they can lead a normal lifestyle and grow up to be completely normal adults as long as they follow the recommendations of their physicians and maintain their treatment plans that they've prescribed.
What is asthma?
Asthma is a disease that affects the lungs. In an asthma episode or attack, the airways in the lungs constrict, causing the lungs to get less air than normal. Typical symptoms of asthma include shortness of breath, wheezing, tightness in the chest, and coughing. Asthma symptoms can range from mild discomfort to life-threatening emergencies if breathing stops completely.
Asthma affects many people, but 1 out of every 13 school-aged children is affected by asthma.
According to the Centers for Disease Control and Prevention, asthma is the most common chronic childhood illness and is the third-ranking cause of hospitalization among children younger than 15. Asthma accounts for many emergency room visits and hospital stays, costing billions of dollars in treatment each year.
What causes an asthma attack?
Asthma attacks may be caused by many environmental triggers that are all around us, both indoors and outdoors.
Children spend the majority of their time indoors, where they may be exposed to asthma triggers such as secondhand smoke, dust mites, mold, cockroaches, and animal dander.
But not every trigger affects everyone in the same way, so it's important for each person to know which triggers affect them most. Daniela is 6 years old. The things that trigger her asthma attacks are found in many homes.
The symptoms that I notice that Daniela gets before she starts getting an attack is she'll start coughing and she can't stop. And so I have to make her sit down for a little while so she can relax. And inside, what causes her to do that is if I'm sweeping or if I'm dusting, she starts coughing, and I can see that she starts getting her asthma real bad.
The triggers that can provoke asthma attack in the home of patients with asthma include such things as allergens that we find in pets, such as cats and dogs, also house dust mites, and also cockroaches in houses that have cockroaches.
To avoid pet dander, if possible, remove any pets from your home or keep the pet outside. Keep pets out of sleeping areas and off furniture.
To avoid dust mites, wash bedding weekly in hot water. Use dust-proof covers on pillows and mattresses. Vacuum carpets and furniture every week. Wash stuffed toys in hot water.
To avoid cockroaches, clean dishes, crumbs, and spills right away. Store food in tightly sealed containers. Use roach baits or traps instead of sprays. Cover trash cans.
We worry about secondhand smoke. We worry about exposure to molds, which grow on surfaces that are humid or that are contaminated with water in the homes.
To avoid secondhand smoke, do not smoke in your home or car, and do not allow others to do so.
To prevent mold, fix water leaks as soon as possible. Clean mold with soap and water and dry completely. Control humidity by using an air conditioner, dehumidifier, or exhaust fan.
Not all asthma triggers are found inside. Outdoor triggers can also cause asthma attacks.
Outdoor asthma triggers include allergens such as pollen or air pollutants such as ozone and particle pollution. Particle pollution is composed of microscopic solids or liquid droplets that are small enough to get into the lungs and trigger asthma attacks.
Patients that have asthma experience symptoms of asthma and sometimes attacks of asthma when exposed to outdoor triggers such as air pollution, primarily coming from ozone, also particulate pollution, such as we see with dusty days in areas in the inner city that are exposed to a lot of heavy traffic.
Taylor, who is 7 years old, started having asthma attacks at a very early age.
When I have an asthma attack, it feels like my lungs hurt and I start wheezing and coughing.
Taylor's attacks are often caused by outdoor triggers.
And try to fall through.
Pollen is usually very thick in our neighborhood because there are many trees.
Oh, dunked it! Oh, you dunked it!
When the wind blows outside, and particularly a fall day or a spring day, not a good day. It's going to be an asthma day. So on those days, we like to keep her inside.
No matter what triggers your child's asthma, his or her school nurse is an important ally in managing symptoms and preventing attacks.
It's a big communication factor between all of us, the staff and her family, and with Taylor herself to help control her triggers because she has asthma related to her allergens, related to the cold weather, related to outdoor problems too.
As a parent, I'm very concerned when I send my child off to school or anywhere when I'm not there to let them know what her health requirements are. But everyone knows that either through my husband or myself or Taylor telling them, listen, I have asthma and these are the things I need to avoid.
Outdoor asthma triggers can't be eliminated, but their effects can be minimized by limiting your exposure to them.
When a patient with asthma lives in an urban center, it's probably of value to them to check to see what the air quality index for that particular day in that particular city is going to be, and they can obtain that information through their local news media. They can also check the signs sometimes that are posted along the highways.
Air quality information is also available on EPA's website at www.epa.gov.
Here are some tips on how to control asthma if outdoor triggers affect your child. Check the air quality index reported on television and in the newspaper. When the AQI levels are unhealthy, remind your child to take it easier outdoors to limit the amount of pollution he or she breathes in. Use an air conditioner to help filter outside air coming into the home or car. Be aware that asthma attacks may also occur or worsen the day after pollution levels are high.
Doctors also encourage asthma patients to keep up with the latest treatments to help them live a normal life.
For Daniela, what I do for her so she'll live a normal life. I first of all, I do continue taking her to the doctor to get checked. I do give her medications. Taylor really has a normal life. They're just precautions that we need to take. She dances, she plays soccer, she's one of the best hip-hop dancers that I know. It doesn't limit her life. As long as we take the necessary precautions like keeping the house clean, watching the air quality index, informing those that she's going to be with about how to manage her asthma should she have an attack, she lives a very normal life.